Fear stops us from achieving our true greatness. Are you a professional woman who is feeling stuck, unmotivated, or burned out? Are you worried about your wellness? Are you letting fear stop you from crushing your goals? If you answered yes to any or all of these, then this is the podcast for you. Dr. Charmaine Gregory, night shift emergency physician, burnout thriver, and wellness champion, along with everyday heroes just like you, will explore how to face fear in our lives and emerge victoriously.
Hello, Fearless Freedom family. Oh my, you know we bring it on the show, and today is no different. Today we have the amazing Dr. Sacharitha Bowers, and she is an academic board certified dermatologist, and she's going to talk to you about who she is and what she is up to. Dr. Bowers?
Hi. Hello, everyone. Yeah. So first of all, thank you so much for having me on the show. And, speaking of fears, this is such a cool experience. This is my first podcast guest appearance. So
tearing off the Band-Aid.
Yeah, that's right. So I thank you for that. And hopefully I won't be, go too off topic here, but yeah, I've been here at my institution as an academic dermatologist for about 5 years. And prior to that, I was in private practice in Seattle for 5 years. And we went out there after I finished residency so my husband could pursue his PhD in green building and sustainability at the University of Washington, which was really the best place for him with his field. And that was really the start of a whole chain of events for me, right from day one. I being here in the Midwest, grew up here and went to medical school here, went to residency here, and it's definitely very different from the big city. So going out to Seattle, there was a lot of transition for me going from a community of, small city, large town out to a large city. And right around that time, 2009, there was a lot of things going on in medicine. The economy wasn't great. There was definitely, I think, healthcare was experiencing a lot of changes. And there was a big uptick in the whole conversation around productivity. So starting at a multidisciplinary clinic, multi-specialty clinic, I was tasked with kind of heading up a new location. And from the get-go, just experienced a lot of experiences now that I can categorize as based in some amount of bias and just not having a lot of support, and experienced it kind of from all ends, both from administration, from colleagues. Just felt very, very alone. And that's hard when you're when you grad, you feel like the world is at your doorstep, especially when you're in dermatology, and the conversation that all your friends are having across the country is, wow, this is amazing. I love practicing dermatology. I make good money, get to go on vacations. Life is fantastic. And here it just felt like everything was in the toilet. So it really made me question my worth and, was I meant to do this field? Was I meant to be a physician? That's really where a lot of my questioning started.
And so what happened? I mean, because we're all waiting with bated breath, because now we're envisioning you bright-eyed and, like you said, feeling like the world is literally, waiting for you. And then you come up to essentially a wall. You come up to an obstacle. So what did you do?
Yes. Yeah, it was definitely a wall, a totally unexpected wall. Well, a little bit of background. I came here from India with my parents when I was almost 4 years old, and grew up in central Illinois, kind of a conservative area. And we were part of a large Indian community in our town. And I was pretty sheltered. I interacted a lot with my Indian community. I did not have a lot of friends outside my Indian community. And my maiden name was Mundlapudi, That's my last name. So with
Okay.
a name like Sacharitha Mandlapudi in the cornfields of Illinois,
That had to be interesting at
yeah,
school.
coming to school with braids and Indian food for lunch, there was a lot of difficulty I experienced in feeling like an outsider. There was bullying, and I didn't have a lot of friends, and I just dove right into the studies. And I mention that because I think so much of who we are as adults is shaped by these experiences as kids.
Absolutely.
And whether or not you gain confidence, whether or not you have, you're exposed to opportunities, and you have, good people around you, good friends, good, what mentors, whatever you want to call it. Those experiences start that whole snowball of confidence, or that vicious cycle away from it. And I think some of that took root. So, just jumping forward, in residency, I felt like it was pretty good. I really liked my residency. It was a really nice supportive program, but again, here in the Midwest. And when I knew it was time to move on and we moved out to Seattle, I wanted to carry with me those experiences in residency that shaped me. So, for example, we did a lot of charity care in my residency program, and we saw a lot of patients who had public aid, Medicaid. And our residency program was one of the only programs south of Chicago that saw, well, actually one of the only clinics south of Chicago that saw patients who either had no insurance or a public aid insurance. And that really, was a formidable experience for me. So moving out to Seattle, I picked the clinic that I picked for the reason of charity care. That was one of their big missions. And I was really excited because I thought, here I am going to this big city, and I don't care about money. I'm going to be a change maker. I'm going to help people, get care that didn't have care otherwise. So when I was recruited, I was very forthright. I'm a medical dermatologist. I, do a little bit of skin cancer surgery, but my focus is medical dermatology, and everything was well and good. And shortly after I was hired, probably a month or two after I was hired, another dermatologist was hired to build out their satellite clinic and build out a cosmetic expansion. So cosmetic dermatology was really on the rise at that time.
I see.
And, where I was at in Seattle, downtown, there was a good medical practice, but there wasn't really a high cosmetic practice, which was fine by me. So my new colleague was heading up another location, and I was heading the downtown location. And it seemed to be going okay the first couple of weeks. I was just very, like you said, bright-eyed and bushy-tailed. And then quickly into practice, I started to feel the pains of not having the right resources, right? So not having the right amount of staff, or not having appropriate or adequate training for staff, not having schedules that were full, not having any transparency in how things were done.
Oh my goodness.
And it was really, really challenging. So, you get paid a salary when you sign on to these big contracts, and, they say, here's your money, go. But you're not really told a lot of the backstory of this is what we expect. This is how we expect you to produce. And if you don't produce, this is what's going to happen. And probably 3 months into my practice there, I was still in the red, meaning I wasn't, pulling in exactly how much I was expected to make to meet my salary. And that's when I had my first meeting with one of the chief medical officers there, who, had just a very stern conversation with me about what he expects out of his physicians right out of the gate. From day one, I expect my physicians to be ready to go. I don't expect you to ramp up and then there was like a litany of stories about how he was ready to go when he started practicing ENT and et cetera, et cetera.
Oh, so he was not even in your specialty.
No, he was like the medical director for ENT, derm, plastic surgery, I think. And
I see.
So he was the one in charge of the number crunching. And in this conversation where he came into my office around the noon hour and lambasted me for not making enough money for the organization, he actually told me to go consider talking to my parents about whether or not this was the right decision. And if it wasn't, perhaps I needed to consider going back to residency training. I mean,
OMG.
this
Really?
was so traumatizing. Yeah, this was I want to say it was about 3 months into this job. And,
Wow.
it was so hard because I had never had any experiences like that before. I'd had the experiences of sort of feeling isolated, of feeling kind of alone, not really knowing where I fit in. But, I was always a hard worker, and, you work hard, and it's things are okay. And so having that just shocking experience of trying your best and taking good care of your patients and not meeting someone else's version of the metrics, and then getting these statements, told to you in your own office was really, really traumatizing.
Oh my gosh.
Yeah. So, and it was just a lot of that. It's sort of that, I won't go into all the details, but it was a lot of that basically for the next year and a half of we need you to make more money. We need you to make more money. And, I really stuck to the standards that I learned in residency. And, I don't do surgery just to do surgery, and I don't do bigger surgeries just to do bigger surgeries. It's obviously based on what patients need and want and what's appropriate for their care.
Right.
And it wasn't aligning with what some of my colleagues were doing. So I was always making, a little bit less because I'm a medical dermatologist. And eventually it came to, well, if you want to stay here and live out your contract, we'll need you to adjust your surgical practices so
Oh my
that you can
goodness.
pull in a certain amount of revenue.
Okay.
Yeah. And so, this was about I would say like 18 months into being at this institution. And I just said, no, that's not going to happen. I'm not
Good for
changing.
you. Good for
I'm not
you.
changing my practices. Like you can hire more, you can get more patients. You can cut my staff. You can do these things to me, and that's fine. I'll adjust, but I absolutely will not change my standards of practice. And nobody is going to tell me what's best for my patients, especially some board of directors that has not even no dermatologists, but no physicians.
Oh wow. Yeah.
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 So
Pain points. Major pain points.
major pain points, and I actually had to ask from my patient satisfaction numbers at this last meeting when we had our, there was like a come to Jesus moment. And,
Yeah.
I asked them, do you guys have any patient satisfaction numbers? I mean, you're telling me all these numbers that I'm not meeting your metrics on.
Right.
And I will never forget that meeting where the CMO asked his assistant, do you have those somewhere? I think we may have them somewhere. And she was filing around through her paperwork, and she pulled out these numbers of, these 35, 40 patients of where I had 100% patient satisfaction, and they had never told me,
Wow.
And it was just, to me, it was like, okay, I know I'm doing an okay job. I know I'm doing a good job by my patients, and that's all that matters. So we had to, I had to agree to part ways. And that was really, really hard, Charmaine.
Oh,
That
I
was really
believe
hard.
it. I believe it because
Yeah.
you're thinking. When you come out of a residency, or for us, and then if you're like, if you're doing something else, like you're coming out of law school, you're coming out of dental school, and you're starting your first job, you're thinking, okay, this is it. This is my, not your forever job, but at least for several years. Well,
Yeah.
you're not expecting that you're going to hit an obstacle like that and have to completely course correct. So yeah, no, I could totally see how that could be very difficult. So then what happens now? Because you had gone there for your husband's career's progression, right?
Mm-hmm.
So
Yeah.
what happened?
Yeah. So, him being in school and being in grad school, my paycheck was our paycheck that, I was
Right.
a sole breadwinner. So they had decided that they were going to involuntarily terminate me due to, not complying with whatever recommendations of, their productivity demands. And I said, fine. That decision actually wasn't hard at all. That was easy.
Right.
I think the hard thing was dealing with feeling like a failure, like I wasn't able to live out my contract for my first job. None of my other colleagues are experiencing this. So I had to, just by sheer nature of our financial situation, I was sort of at a mercy to them to accept their the requirements on this termination contract, which was,
Okay.
I believe my 2 years was going to be up in September.
Okay.
And so they wanted to finish out, they actually wanted to replace me with another dermatologist who was a surgical dermatologist, which made sense for them because they figured, well, we're going to get more money if we replace her position soon. So they actually wanted to terminate my contract early before reaching my 2 years. And because of that, they gave me like an extra month's salary, and they gave me a little stipend. And it's now, and I didn't know this back then, but in hindsight now, I think it was one of those, what do they call those?
Hush money?
Non-disclosure. Yeah. NDAs, non-disclosure agreements.
Oh yeah. Mm-hmm.
Yeah.
Mm-hmm.
Like you can't say anything negative about us.
Right. Yes,
and
exactly.
I remember reading that and thinking, this doesn't look good. This looks like this is hush money.
Yes, exactly. I was like, man, that sounds like hush money.
And this is exactly what they're doing, is exactly what I don't, this should be, they shouldn't be allowed to do this, but we had no other option. We didn't have any other income, and I didn't know what I was going to do for a job. So that I had to sign that, and that was painful.
Oh,
but, you do what you have to do for your family, right?
Absolutely.
So,
absolutely. Yeah.
so then I ended up getting another job at a different multi-specialty clinic, and I decided, okay, let me
You probably
learn.
went into this one with your eyes wide open now, right? Because you knew like what pitfalls on contracts to be aware of.
Yes, and it's exactly what we always talk about with each failure or setback or whatever you want to call it. You learn something, and it might be something small, it might be something big. But I thought, okay, there's not another practice I can join, a small practice. I don't know too many people in Seattle still. It's not even been quite 2 years. I will join this other clinic that was looking for a medical dermatologist, but let me join on my terms. So like a locums contract, where I would be month to month, and there wouldn't be any long-term agreements. Okay. And that was a smart move.
That is smart.
Yeah. And it's a smart move on both accounts, because if for some reason they have their metrics that they don't feel like, it's a match, they can always decide, it's not a match. And I also learned really quickly in practice that it's all about fit. It's about whether or not you fit. And I don't think we tell that to our trainees.
No, we don't, which is really sad. We don't.
Yeah. And it's not that if they don't fit somewhere, it's not their fault that they don't fit somewhere. It's like some things just don't go together, and it's not right or wrong. But so I signed with this other clinic, and it actually was just a short walk from where we lived. And I got pregnant with my first child, Vivian.
Oh, nice.
During the start of that job. So I was there for about 10. I was there until it was time for maternity leave, basically, until it was time to have my child. And, after that, after I had her, I took 3-4 months off work, and I actually just left that clinic and decided, I'm not sure if I'm going to come back or not. It was a lot of the same stuff.
Got it.
Productivity. You're going to get 1 MA, but we expect you to see 35 patients a day.
Oh my goodness.
And 35-40 was the standard.
Wow.
And with 1 MA. And then you can get a second MA if you can get to that 35-40, then you can get a second MA. And this was a big thing in Seattle at the time. A lot of clinics were building new satellite locations. So you have to pay for it, right? Build it and they will come, but you got to pay for it. And who pays for it but the providers?
Wow.
So actually after when I was on maternity leave, I had a good friend, their nurse practitioner was leaving, and they really wanted to replace her with a dermatologist.
Okay.
And so I was able to join their practice, and it was a wonderful experience. It was basically where I worked until we decided to move back home.
Oh, that's awesome. I'm so glad that the story ended well.
Yeah. It did.
Like you hit stumbling block after stumbling block. It's like, seriously, is this going to work out okay?
Yeah. And, in that time, there was several conversations with different people that were very, very unsupportive, looking for other voices that you can connect with over these fears that you have on, is this just me? Am I the only one experiencing this? Like, is there anyone else out there who gets it? And I learned back then that a lot of people have the same fears, but they don't want to say anything.
They feel bad.
Yeah, they feel bad, or they feel like a failure. And so they just keep going. And so that person that decides that, no, I'm not just going to take this ends up being the lone wolf.
Yeah, that's interesting. But you know what? I think I talk a lot about burnout because I experienced it, but that is one of the things that just the same thing you mentioned, where you're in a practice environment where you do not feel like your efforts are appreciated. You feel like you are a cog in the wheel. You just don't feel like there is any reciprocity between yourself and the organization that you are working for. And that can definitely lead to burnout. But I think people don't want to talk about that because of, everybody wants to put forth their like highlight reel, right? I mean, they want to put forth the best self or the best situation,
Right.
and they don't want to be seen as a person who, no, this is not working out for me. And I need to think about what is going to be good for me because I'm valuable. I have a lot to offer. And yeah, I should get what I want, because if I'm happy, I'm going to take great care of my patients. And in the long run, it's not a numbers thing. It's like a money crunch numbers thing, but it's like a human value thing, right? But
Mhm.
I think that we just are not in that conversation. We're just not there. Most of us, because we train in a situation where you have to be tough, and no matter what, you have to keep going. And you
Mhm.
sick as a dog, but you still got to like slap an IV in and hydrate yourself and get back to work. I mean, this is the mentality. So if you show any signs of quote unquote weakness, then, that's it. Nobody wants to be seen that way. But that is not weakness. That is actually strength, because you have the strength to set a boundary, to say, no, this is not going to work for me. This is not going to be best for me or my patients or the organization, and really, drawing that line in the sand. And I think that that's not viewed as a strength, but it really should be, because it is, right? I mean, because like
Absolutely.
you're going against the grain. You're not like the typical person who's just going to fold and just let it ride because you feel obligated to be tough. We should.
Absolutely. I mean, you hit the nail on the head. And I feel like I've been saying those exact words since I started practicing, and it was like right off the bat I knew that, okay, for example, we have in that first job I had, our biopsy specimens were being read by a general pathologist and not a dermatopathologist,
Ooh,
and we kept having errors in our biopsy readings. And
right,
this is the first couple of weeks. And so I lobbied for a dermatopathologist, and I got, promptly turned down. And then I came up with a report on how many of those biopsies that we had where could have been read better or differently, or wouldn't have to be sent out for consultation.
right.
This is how you can actually save money. And then I got turned down. And then I ended up organizing a meeting with our other colleagues on some system safety issues with these biopsies. And then I actually got in trouble by our organization for organizing a meeting without letting the managers know.
Oh my
So
goodness.
it was like thing after thing after thing. And the
Yeah,
thing about it is, I had my colleagues all felt the same way, but it was like it's, and I don't want to say anything negative about any of my colleagues, but it's like, for many reasons, people either are too very busy, or they feel safer not saying something, or they're in their own positions of what's going on with their life, or
right.
their financial situations where they can't really put any risk out there in their job being in jeopardy. And I just, for me, from the beginning, I didn't have kids at this time, and I
Right.
really felt like, I did not enter this profession to be okay with things that are not okay.
Right.
And I agree with you completely. To me, it's such a sign of strength and bold courage to say, this isn't okay. And, I may not be able to change things per se, but, I can't sit quiet. I need to, in some way, make my struggle known. Um, and so over the course of my years in Seattle, there were so many similar instances of me standing up for myself. Like with my first child, I had hyperemesis gravidarum,
Okay.
and it was very, very hard. I was throwing up 10, 20 times a day, and I was working. And when I spoke with my colleagues, they were basically like, you got to be tough. If you're going to be in medicine, and these are women, female physicians who had kids,
Oh wow.
you if you're going to be a physician, you got to be tough. You got to be able to show up to work. Unless you're on your deathbed, you have to be able to do it. And I just remember thinking, where's the humanity in this?
Yeah.
Where's the empathy? And so it was just, there was a lot of experiences where I just felt like, where's the medicine, where's the empathy in these doctors, in their own selves, in their colleagues' lives, in the lives for their staff. Everyone is just so wrapped up in the day to day, churning out patients. And it from the get-go, it really, I think, really changed my lens on how I view healthcare. Well, I wouldn't say changed it, but it really brought me forward with it. Like, I'm going to be bold. I'm going to speak up.
Wow. No, that's amazing. I mean, you touched on so many things there. I mean, the fear is literally palpable that you describe. I mean, in your colleagues and as women in medicine, what can happen. And it is, I mean, standing up and saying something definitely takes a lot of courage. And thank you for doing that.
Well,
and it sounds like you did it multiple times. So thank you for definitely doing that. Because, I am sure, and you may not see the effect of this, but I'm sure that because you said something on several occasions, that bug is in the ear of those who are listening. They may not necessarily take action at that moment. They may have taken action probably after you've left, but the fact is that had you not said anything, that would never probably have come to light. And, patients would have suffered as a consequence.
Well, it's interesting you bring that up, because I did find out a couple of years ago that very first practice I joined, the multi-specialty clinic, they did in fact get a dermatopathologist.
Oh, look at that. Look at that.
It was after I left, and it was probably because some man told them that they should do it. But I don't know. But it was just, it was just one of those things of like, I was glad that the issue changed, like the problem got solved and they got into pathologist for the sake of patients. But that's why you do it for so many reasons. You do it to be true to yourself first and foremost, because I got to go to bed with my own self at night, so I have to live my life authentically. And I would rather deal with the repercussions of speaking up and be authentic to me than to deal with my own repercussions of not speaking up. But then
Amen,
you never
sister.
know. Yeah, right. But you just never know what's going to happen with that. 10 years, 10 days on the line, 10 months on the line. Who knows?
Yeah. No, the effects can be delayed, but they can be great, So I would definitely say that I'm sure if you were to do a rewind and go back, you probably would do things the same way. Am I correct in that?
You are absolutely right. Yes, you got it, sister. Like, I have actually said that to my husband. If I had to go back and do it all over again, I would still join that first practice, because I know why I picked it. I picked it for their charity care mission. I would still pick it for their charity care mission. I didn't know what I didn't know. You know what you don't know until you live through it, right? And living through it is why I am doing the things I am doing today. And if I hadn't lived through that, then I may have had these lessons later in life. So I wouldn't change a thing that I did. Every organization I joined for a very specific reason. And every single time I stood up for myself. And I said, I was always the doormat growing up. I was so shy, so painfully shy. And but in my heart, I always knew what I wanted for the world, for myself, for my profession. So now I feel like, oh, wow, I get to be an adult and I get to have a choice, right? I get to say, like, this isn't okay. And it might not go my way and it might be hard, but I can deal with that,
Yeah. No, I hear you. So let's hear what you're up to these days. You're up to some exciting things. So let's
these days, yeah, it's wild. I need like 35 hours a day or something,
Oh.
It's craziness, but no, things are really good. My plate's very full, but I'm very grateful for it. I have 2 little girls, ages 3 and 6, and so they're keeping me busy. My husband is actually weeks away from defending his dissertation.
Awesome!
Yeah,
That is great.
he took care of everything. When we moved back here and I joined faculty, he worked on finishing up the dissertation from home.
Okay.
They said that was fine. So we moved back and he wasn't quite done yet. Well, in that time, we had another child. And that second child, I had even worse hyperemesis for.
Oh, no.
Yeah, I actually needed a PICC line in TPN with her. So
oh my, that's pretty severe.
That was craziness. That's why we're not having any more. But he's the one who's taking care of, I got to give him a shout out. He's the one who's taking care of everything at home and the bills and the gardening and the this and the that and the laundry. So he's kept our household afloat while trying to finish his PhD, which is why it's taken him longer than, he's at the 10-year mark now. So
Gotcha.
they're going to kick him out if he doesn't defend by the end of the summer. So,
but he will. So he's not going to get kicked out.
I know. We always joke about it. We're like, yeah, you're going to get it right under the wire and it's going to be amazing. Like all this time. And I look at what he's wrote and the way he talks about it and how he's grown. And I'm floored. I honestly, a PhD is mind blowing to me that someone can be that focused and explore an idea or concept or, research hypothesis to that degree. It's such an incredible feat, honestly. So we are so excited for him to finish. Of
course.
And I'm going to go. He told me I could watch.
Okay.
So, Yep. So we're going to do that. And then in terms of work, I became program director 2 years ago. So that takes up a good amount of time. Program directing is challenging in recent years because the number of expectations that the ACGME has for program directors has really increased dramatically. So that keeps me busy, and where our residency program is expanding. So we will be 25 years old next year. And
congratulations.
Yeah. And it's, still relatively young as residency programs go, but we've had 2 residents a year, so it's a small class, but we're going up to 3 residents a year. So, and we're adding another faculty member. Our chief resident is staying on as faculty, and he's the first one to stay on. So so our program is getting a little bigger.
Yeah,
and I recently was offered, and it'll be starting here the next month or two, the vice chair position for the Department of Internal Medicine's Diversity, Inclusion, Community Engagement, and Equity.
Awesome. Congratulations. That is splendid news. Wow.
Yeah, it's really cool. And it started as a very raw and kind of spur of the moment thing. After the election in 2016, there was this big spike in hate crimes.
Yeah.
I was watching the Southern Poverty Law Center's hate crime register, and it was just going up and up and up. And there was all this really divisive, terrible rhetoric. And I just, frankly, I was like, is anyone else feeling scared, concerned?
Oh, yeah. There was lots of people.
Well, and I just felt like it was the elephant in the room at work. Like, can we talk about this as physicians? And so I had actually emailed our dean of our medical school and said, hey, any chance you'd be okay if I just put a forum together of people to just come and just talk about what's going on?
Right.
And he was like, yeah, actually, sure. Well, you know what? The next day he put out a statement to the entire School of Medicine, just, commenting on just the events around the country, and just knowing that, reiterating that we're we're a place of inclusivity and diversity. And so that was really nice.
Okay.
And I held this forum, and it was amazing. It was 60 docs that came, and lots of staff and students. And basically it was just, let's talk, let's talk about how a lot of people did not talk. A lot of people just kind of listened to a few people talk. But what was neat about it is it opened this door of, I'm interested in this. I'm interested in inclusion. I'm interested in health equity. We need to be talking about these subjects and how they're impacting us as physicians, how they're impacting our patients, our trainees. And so from that came the offer to speak about implicit bias to our department. And then from that came, another thing and another thing. So, fast forward, and now, so now there's this position that my chairman is wanting me to take. And my first thought is, I can't do it. I'm me. like immediately it's that imposter syndrome, that voice saying, why me? The justisms, I call them. I'm
Yeah.
just a dermatologist. I'm just a assistant professor. I'm just a, not even a mid-career faculty member quite yet. Why would you pick me? And, and he seems to think that I'm going to
He
be,
knows he can do it. That's why.
well,
That's
he
why
knows
picked
something
you.
I don't know.
That's why he picked you, because he knows he can do it.
So, but it's been a really, for me, a very just organic process of just following what moves me, what motivates me, what gets me fired up. And, and sometimes that means there's some more things on your plate, but I'm excited because I think we can do some cool things with the department and hopefully collaborate with the School of Medicine and hopefully I can use what I'm learning in the dermatology sphere to increase diversity in dermatology too.
Definitely. Yeah. No, that sounds awesome.
Thank you.
Yeah, you're right. I mean, you totally nailed it when you said when you start to follow the passion inside of you, that's when all the doors open and the great things start happening.
Yep.
And and so it's funny because that kind of going back to your experiences previously in Seattle, it's funny because it started with you setting that boundary and realizing who you are then and standing up for yourself. And has led to now you're at a place where you're like, look, this is what makes me happy. This is my vibe. This is my why. And just pushing through and people recognizing that because, that's the ticket. Because we don't always know our direction. We don't always know our path. We don't always know our passion.
Yes.
And so when you know it and you speak it into existence, then all these great things happen. So congratulations on every single level. I mean, that's just so cool.
Thank you.
Super cool.
And
awesome.
You talk. I love your whole podcast and your concept of your podcast and what has motivated you to get to reaching out to so many people is so powerful because fear is it's fascinating to me because fear motivates us in some ways, and it can motivate us to not do things and it can motivate us to do things. And when I first stood up, in this first job, when I was saying, we need to have a dermatopathologist, this isn't okay, or it's not okay that you're telling me to do these surgeries. I remember telling my husband, I was always the kid that was afraid. I was the kid, I wasn't athletic. I got bullied. I got spit on. I got pranks played on me. My name, oh my God, did people make fun of my name, my entire life. Yeah. I mean, I developed such a sense of fear of standing up to people. And what was so crazy is I never, ever thought of myself as a leader, ever in a million years. I ran for things and I lost, so I always felt like I'm not the leader, I'm the follower. And when I first stood up against my job, I told my husband, I am not a follower. I am not a follower. And I think I never thought of myself as a leader, but isn't this what that is? And it was this really interesting conversation we had of, him telling me like, this is an example of you being fearless. And
that's right. That's right.
You own it. He said, you own this stuff and you are not afraid of anyone. And I think that's what it is I just see people as people. It's like, it doesn't matter if they're the chairman of blah, 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 or the CEO of XYZ, it doesn't matter because to me, it's like, we're all in this doing a job. And, it could be, it could be the president sitting here and I would say, you know what, that's not right. So I think that concept of fear is so amazing to me. And if we could channel that fearlessness of like, we can all talk to each other in a way where we don't need to be afraid of the outcome. We just need to be afraid of not being ourselves. Like, how much more could we all accomplish?
Oh, yes. Oh, yes.
Right?
It would be incredible. Absolutely. No doubt about it. But that is an awesome segue. And, we didn't even plan that. That's pretty cool. So we're talking about podcasts. And before the show, you told me a little something. What's coming out at the end of this year?
So Yes. Speaking of fear, well, so being a dermatologist and being in academics, I see a lot of patients, obviously, with medical dermatology conditions. So conditions like psoriasis, vasculitis, cutaneous lupus, autoimmune blistering disease, alopecia, vitiligo, etc. And being in an academic center, we see the more complex cases.
Okay.
And where we are right now in our country with healthcare is it's a rough patch right now, right? We're in a tough spot with the cost of medications rising, the cost of generic medications rising to astronomical prices, also prior authorizations being a big burden, not only for patients, but also for physicians and staffing, et cetera. So it's just this vortex of complexity for patient care. And it's hard enough to have a medical condition and a skin condition that really affects your sense of well-being, affects your health, affects your sleep, affects your mood. But then on top of that, to be denied medications to make that better, to go through this really circuitous, complex route, to only be told, okay, you have to use 3 of these medications that aren't even, appropriate medications to treat your condition. It's just, it's been crazy. And I keep hearing patient stories about this, about how they're living with their skin disease and how they're living with their skin disease in our healthcare system. And we do a lot in terms of trying to advocate for patients and getting their medications approved, calling insurance companies, writing letters, etc. And sometimes it works and sometimes it doesn't. And recently I've been trying to be a little bit more vocal on other social media platforms to get some of this out there. Like, we need to be talking about this. And certainly people are, out there doing a lot more on social media in this regard than I even am. But one thing I haven't seen as much as, and I really want to highlight, is the stories from the patients themselves. So I think the power of hearing from a patient their own unique story on how their disease is affecting their day-to-day life, their well-being from their own words, is more powerful than anything I can say or you can say or any one of us can say on how that disease is affecting that patient. And how having someone hear how that patient has to navigate all their different medication costs and not getting something and it being shipped to the wrong place. And then when it's shipped to the right place, it turns out it's not covered anymore. I mean, that's absurd. And I just feel
I
like
shouldn't have to deal with that.
it's the patients need to be able to tell these stories, but the public needs to be able to hear these stories. And maybe if we can put a spotlight on them, maybe that'll be one tiny extra drop of influence towards positive change for patients. And I kind of modeled it after the thought of, that I think it's on social media, the Humans of New York series.
Oh, yes.
Yeah. They highlight people and their experiences and their stories. I just think that's such a cool thing to do. And so I would like to do this for patients living with skin disease. And I'd like to do it in a podcast form where I actually, interview patients and we get them talking about what it's like living with their psoriasis and navigating the healthcare system with it. So that's the plan.
And so I'm looking forward to it.
Yeah. So now it's out there. Okay. So now we're going to circle back. We're going to circle back at some point and say, yeah, it's happening.
Awesome. Yes. Do you have a name yet for it, or?
Oh my gosh. Yeah, I have a list. I have a list on my notes section in my iPhone on like 10 or 11 different names for it. And some of them are longer and some of them are shorter. And I've been crowdsourcing these names to my family and some other people. So yeah, I've got a couple of ideas. So I felt like that was actually a really nice step for me to come up with a name, because naming it gives it more life.
Yes.
Yeah.
Awesome. Yay. I'm always excited to hear more of us doing podcasts. So that's kind of
well, and there's a lot of people whose brains I'm going to pick, and you're right up there at the very top.
Okay, I'm still a baby in this, but I am happy to share what I know and what I've learned so far. So no problem at all. Awesome. So we are at that point in the show where we do our tradition, and that is fill in the blanks. The first question is, are you ready?
Yes, I am ready.
All right, sweet. The first question is, fearless freedom means,
Mhm.
what does that mean to you?
Okay. Well, to me, fearless freedom means feeling you're capable of doing anything, right? Not being stifled to pursue your ideas and your ideals. You have something that's idealistic to you, but you're not afraid to pursue that. Going for those sparks of inspiration and not worrying about failing or being a disappointment to someone else's expectations. I think that that's what it really means to me, is it's being fearless and then free to really be your own authentic self.
Awesome. And then, if I am fearless, I will.
If I'm fearless, I will succeed. I can find professional and personal satisfaction, and most of all, I can be happy.
Sweet. And then last but not least, my battle cry is.
My battle cry is just feel it. Feel
Oh, love it.
Or own it. Take a deep breath, and then you can move forward. If you feel it, you can act on it. And then if you act on it, you can move forward and move on to the next thing in your life. But you got to feel it.
Oh, that's awesome. Thank you for sharing. Definitely has been a great conversation, and we'll all be looking forward to hearing what the final name is on the podcast, and also listening to the podcast when it's released at the end of this year.
You got it. You are my accountability leader number one.
And now you have several hundred people who are also going to be waiting for it.
Yeah, I sure do.
Oh my goodness. Thank you for joining us today on this journey. Fear is all around us. It strives to stop us from achieving our greatness. We have the tools to be overcomers. By sharing our stories, supporting each other, and doing self-reflection, we can do this. If you found value in this conversation today, please be sure to subscribe to and share this podcast with your friends. By going to your favorite podcast platform, leaving a review and a 5-star rating, you will help to get the word out about it. And that is much appreciated. Thanks again for spending time with us. I appreciate your time and your attention. It is my hope that you will punch fear in the face today, and that you will be strong, be brave, and unleash your greatness.